Welcome to San Diego's most popular local morning news. Good morning, San Diego.
All right, school is about to start, which means thousands of young athletes are starting to practice once again, and many of those athletes will be young women who studies show suffer up to 8 times more knee injuries than men. Here to discuss what's being called an epidemic of knee problems for young women is Dr. Tal David, local orthopedic surgeon and team physician for our own San Diego Chargers. Dr. David, thanks for being here. Appreciate it.
Thanks for having me.
Talk about this. Why do women suffer so many more knee injuries than men?
Well, one of the problems is that women have 2 particular anatomic issues. One is the way that their legs are aligned, and the other is a muscle imbalance problem.
Okay, so what is with the alignment? What's the problem?
Well, women tend to have wider hips than men. The wider hips put them at a risk of having more of a knock-knee alignment, and that puts a lot of stress on the ACL, one of the main ligaments that stabilizes the knee.
Okay, and then as far as the strength of a woman's legs, why do they have issues when it comes to knees, or what causes the problem?
Well, it's very important to have a balance between the quadriceps muscle, the anterior muscle in your thigh, and the hamstring muscle, the muscle in the back of the leg. And women tend to have weaker hamstrings in relationship to their quadriceps, again putting their ACL at higher risk of tearing.
So what can women do to prevent injuries, these torn ACLs, and strengthen their legs?
Well, one of the things they can do is they can work on strengthening the leg in general. Strength and balance is very important. They can work on deceleration, how to land. I'll give you a personal story. I've got 2 little girls at home. One's 5 and one's 3. Not exactly high-level athletes, but I hope that one day they will be. We have a box in the garage. It's about 1 foot off the ground, and we practice jumping off of that box, because we know that when women land, they tend to land with knees that are straighter, and that puts them at risk of tearing their ACL. So one of the things that we've done is practice jumping off the box and landing on bent knees. That's a very simple thing you can do at home, and it can really help prevent injury.
Very nice. And maybe doing some weightlifting exercises as well to strengthen those legs?
No question. That always helps.
A little bit more about repairing injuries like this and some of the new technology, because there's some great new technology out there.
Well, one of the things that we're trying to do is recreate the ACL, reconstruct the ACL more and more in its normal anatomic position. We're looking at different ways to reconstruct the ACL in terms of what kind of tissue to use. And one of the things that I'm excited about is a new device called the ApiFix that we've been using to reconstruct the native ACL in an almost anatomic position.
Now, what is so wonderful about that particular device?
Well, it's made of a material that's pretty new in sports medicine called PEEK. It's a bio-inert material that doesn't react with your body. And it has one of the highest strengths of a reconstructed ACL that you can have.
Very nice. Before we let you go, we have to ask you about the Chargers. What are your thoughts about the season? I know you can't talk about, you have to be tight-lipped about certain things, but what can you tell us about what your thoughts?
Well, I'm excited about the season, and just like any other fan, I'm hoping for the fewest number of injuries and the highest number of W's.
There you go. Nice, very nice. Well, Dr. David, thanks for coming in.
It's a pleasure.
Some really nice advice there to prevent those kind of injuries.
Thanks for having me.